ACL injuries are very common in all types of sports, whether it's high school, college, or even professional. This type of injury is most likely to be seen. ACL injuries have been around for a long period of time, and with the advancement of science and technology, the methods of treating and preventing this injury have evolved. Imagine you're watching a football game. The player is running towards the other end of the field, and then suddenly he gets tackled down from the side of his legs and is laying down holding his knee, unable to get up. You just witnessed a severe knee injury. Knee injuries are very common in the sports world, but the most common type of knee injury is an ACL tear. First, I'll explain to you what is an ACL injury, followed by how the injury occurs, and lastly, how to prevent this injury. I will now begin to explain what is an ACL injury. The ACL stands for anterior cruciate ligament. This is one of the 4 major ligaments that is found in the knee, but this ligament is located in the middle of the knee. An ACL tear can occur when a sudden stop or changes happen in the sense of change of direction, jumping, or landing. Most common sports that are involved with ACL tears include soccer, basketball, and football. An ACL tear can occur when someone gets hit very hard on the side of the knee, for example, a football tackle. When an ACL tear occurs, the most common symptoms to occur are a loud popping noise in the knee, severe pain, swelling, no range of motion, and the sensation of the knee giving out or giving away. According to Mayo Clinic, many people that have experienced ACL tears have heard a popping from the knee and instant swelling as well when the injury first occurs. An ACL injury occurs when there's a sudden change of direction in the knee. So now that you have an understanding of what an ACL injury is, let's move on to how to treat this injury. There are several ways to treat ACL injuries, but the most common treatment for this injury is having surgery, especially if the person is very active or if they play sports. According to OrthoInfo, most ACL tears cannot be stitched back together. They have to be reconstructed with a tissue graft. The graft can be taken from the patellar tendon, hamstring, or even the quadricep. This type of surgery that is done for the ACL tear is called an arthroscopy surgery. This type of surgery is less invasive, less pain, less time, and it even has a quicker recovery. It also has very small incisions as well. Although arthroscopy has a quicker recovery time, the graft itself can take up to 6 months for an athlete to return to playing their sports after the surgery. After the surgery, the patient will be wearing a brace to help support the knee to make sure that the graft is staying in place. Furthermore, after surgery, the patient will have to attend physical therapy and regain the strength and function of the muscle in the knee. The best treatment plan for the ACL tear would be to have an arthroscopic surgery. Now that you know the treatment course of an ACL, let's dive into the prevention for this injury. For anyone that is trying to prevent an ACL injury, there are several ways that can be used to do so. Some include exercising, using proper form or technique while playing sports, and also wearing a knee-supported brace as well. According to ACL Injury Prevention Tips and Exercise, they suggest that one of the best ways to prevent ACL injuries is to warm up and to do all kinds of knee-related stretches, such as abductors, walking lunges, squats, and so much more. They also suggest to focus on agility change, so the knee can get used to the sense of change of direction. If anyone decides to wear a knee brace, they also have to take in consideration that the brace is not fully going to prevent the ACL injury. It's mostly used to help support the knee while playing a sport or exercise. To prevent an ACL injury, remember to properly warm up, stretch, and use proper technique if playing a sport. Let me finish the discussion on ACL injuries with a few more thoughts. I explained overall what an ACL injury is and what an ACL stands for. Then I also provided information about surgical treatment and if an ACL injury occurs and information about that surgery itself. Then I lastly provided different types of prevention of the ACL injury. So next time, if you're watching a sport and you see your player go down because of a knee injury, you could identify that it could be possibly the ACL injury. If any of you are interested in learning about ACL injuries or sports-related injuries, then sports medicine is probably the best route to go.